So the clinician is not going to necessarily know the exact milligram dosage that you might need for every hormone. And more importantly, when you put a whole bunch of different types of hormones together into one plan, those hormones can start talking and influencing each other. So it wouldn't be your clinician's fault if they didn't get it perfectly right on that first time. And actually, you have to keep in mind that most likely they won't get it perfectly right, okay? So I need you to understand that. So within the first couple weeks, that's when you're sort of just starting to get the feel of how it's going to feel. Now, if you're not where you want to be feeling, meaning, let's say you have hot flashes still, then most likely your dose is going to need to be tweaked or increased, or in that case increased, but maybe decreased in other cases. And so there's a specific type of way that we can actually get to this balance more quickly because of the uniqueness of each patient. Just like you, you're very unique. No one else is like you. There's no way to know how this hormone regimen is going to affect you when given to you as a whole. Does that make sense? So what we're going to do is talk about the method which we call one tweak a week. So let's say you're on estrogen, and that estrogen it's okay, it's doing a little bit, but it's not exactly where it needs to be. And how do you know? Because you remember what each symptom is, and you remember what each hormone can actually be causing that symptom or lack thereof. And so then you can understand, okay, I know, for instance, that a lack of estrogen can cause hot flashes, and I'm still having them. So therefore, I think I need to increase my dose. Now, don't go on and start increasing your dose by yourself. You talk to your clinician, you give them the lowdown, you say, hey doc, I am experiencing this. And they're going to say, okay, I want you to increase your dose by a half dosage point. So let's say, for example, you're on 0.5 milligrams of estradiol. Then, to increase it by half a dosage, you'd be now on 0.75 milligrams daily. Does that make sense? Then you would wait 1 week and see how it felt. So, within a week later, all the hot flashes are gone. Great. Then we've done our part, and we've gotten to the balance. If they're still there, call your clinician. It's probably time for another tweak. So that's the one tweak a week method. If you have tweaked it twice and you are still not getting the results, guess what? It's probably time to go down and visit your clinician physically. The little tweak method is only as good as it can be. There are limitations. It can get really involved with hormone therapy, as you can understand and imagine. So this is just one example. A lot of patients ask me, when am I going to start feeling better? How long is it going to take? And I tell them typically they're going to feel something within 1 or 2 weeks. But the story's a little bit deeper than that. Within 1 week, you should be feeling something, and by week 2, you're pretty much going to be feeling what you should be feeling, what your clinician intended you to feel. And if you're not, then you didn't get the dose right. Now you're going to say, well, wait a minute. I'm supposed to be going to this clinician who's supposed to be so knowledgeable and able to understand the exact dose that I need to be on. The problem is, when you have a unique patient with a unique hormone level and a unique symptom set, which is what you would have, no clinician can look at you and say, you look like you should need 32.5 milligrams of progesterone. That's not really what's going to happen. It's very important that you know that this is a work in progress. Your doses are not going to be magically perfect the first time you go in. If you don't take charge of your own health and proactively get to this balance quickly like your clinician wants you to, you're going to be dissatisfied. You're going to give up too soon. Don't do that to yourself. You owe it to yourself to get back in balance, and you can, but you have to take charge. And this is why we've been discussing all of the symptoms that are involved with AGED. So when you know each symptom that you're experiencing still, you now know which hormone is responsible for that imbalance. And then you talk to your clinician, whether it be through email or through a simple phone call, and say, I still have this. Tell me what to do. I think it's this. What do you think? If you are not proactive this way, I guarantee you're going to be dissatisfied with your treatment and you'll probably give up. And don't do it. Take charge.